Am I audible enough?
Yes, yes, you are.
Okay. And a very happy new year to all of you too. Uh, should I start by the screen share? Let me try that.
Yes, ma'am.
It is still disabled.
Can you try it
Yeah.
now?
Now I can. Now I can. That's visible to all of you, right?
Yes, it is.
Okay. All right. A very warm welcome to this afternoon. We'll be speaking, I'll be talking for an hour and maybe 10 minutes, and then we can go in for more further discussion as and when necessary. But since it is more of an interactive session, and because positive psychology is something we all have read about, it is not new to anybody. So I would also request anybody to raise their hands whenever you feel like interacting and talking or just contributing to the topic. And so let us learn from each other today. Okay. All right. I think, positive psychology, when we talk about the word itself, says that our outlook towards life, right? And which is supposed to be a positive outlook towards life. But we also know that we have got myriad of emotions around us. We are filled with emotions, and it is a whole range of it. So, as we are happy, we are also sad. So it's a whole spectrum, and it's a paradigm of all emotions. So, to come up with the first question that I have for you is that, do you get angry? You can put it in the chat. I'm trying to, yeah. You do? Yes, yes, yes. Of course, we all do. I think yes, Parul is a big yes from her. so, so what do you do when you get angry? What do you do when you get angry? You can speak or you can also put it in the chat. Either way, I'm comfortable. All right. Yeah, Lakshmi. Yes, we show it to others. Lose our cool, right, Sunita? Yes. Ah, yes, shout at others, vent it to the nearest one, and it's usually the people we are closer to that we are angry at, right? 100%. I sleep when it goes. Yes, I think that's a good way to do it. To sleep and oh, your poor husband, Moshmi. uh Yes, you we tend to also eat a lot of junk food and things like that. Or sometimes, yes, we also hurt ourselves. And I think it is very apparent. Thank you so much. Uh, Thank you so much for all the lovely feedback. And I think we also hurt ourselves, especially young people. They have that tendency of self harming too. Yeah. Yes, he's a good listener. I think, yes, marriage is survivor because we have got some good spouses who listens to us too. Right. Okay. So it is so we have got different emotions, and we, of course, the anger. I took it up because it's something very common that we all have, and we express it in different ways. And if you have noticed, again, not every time we express anger, it is very constructive. uh, Going to the next one, yes. So Aristotle, he very beautifully he said that anyone can become angry. That is easy, but to be angry with the right person to the right degree at the right time for the right purpose and the right way, that is never easy, is it not? And this is what we will try to talk about. This is what we're going to talk about as to what we can do to enhance our positivity with the help of positive psychology. If you see, why do we get angry? Even if I'm talking about, I'm just taking example of that emotion again to just put in the explanation here. Why do we get angry? A lot of times, I feel we get angry because things did not go my way, right? So the way we look at life also is based on a lot of assumptions that are there, which again, the assumptions are based on a belief system. If I say that everything should go my way, then automatically my belief system is such that my assumption will be that why is not everybody listening to me, or why is it not going my way? So, and of course, the fallout is that we are angry. So, our belief system actually projects onto our thoughts. Our thoughts are projected as our action, and our action are shown and reflected as behavior. Okay. Yes, our perceptions and our experiences. Yes, Prashanda, you said it right. Yeah. So, again, so this was the kind of a premise that I wanted to base it on my interaction, because when we are talking about positive psychology, it again boils down to our belief system and how we look at what is our worldview. So, some of the learning objectives that will be here today is that the understanding of our own well being, because positive psychology, when they say it is all about well being, then a little bit about what is positive psychology and a little bit of a theory of positive psychology. It's a huge topic, so I'm just trying to concise and precise it to whatever extent I can here. Then to practically look at, if I'm looking at a case study as, and to also find out what is a communication pattern that we can take when we are looking from the positive psychology perspective. It is, and there are a lot of similarity as to how counseling is also done. So I'll be merging these two a little bit more, and then a little bit on a more rather than self-compassion. Do I have written it here? It will be more about how you are going to look after yourself. Will be something that we will talk on. All right. So let us do this small exercise first. This is a small activity which I would like all of you to do, where if you look at it, now let us, media is all the time there, and I don't know how many channels are there in India, of all the with English and regional languages and everything. So now imagine that you are a newspaper reporter, all right? And your assignment today is to describe the thoughts and actions of people who are stranded one evening at a large airport because of really bad weather. You know, think about it, think about what is happening there. And just, you don't need to write a big, just give me one or two pointers as to what are the things that you will reflect upon when you are going to write this assignment. I'm just giving you maybe a minute to do so. Yeah. The reason for bad weather, Parul, just put it in your imagination, because it's a, just a imagination of mine too. When I said bad weather is, it can be bad weather. Suppose if you're in a big airport like in Dubai, maybe you will be thinking about all the storm that is there, sandstorms coming in. Or if you are maybe, in some European countries, then of course then there can be snow there, so we don't know, you may be stranded for all the terrible weather that can be there. That can be cyclone, that can be anything. All right. So you said that. So I'm getting some responses coming in. People are panicking. Sandamita, hi. She's with us in Mind India. So, and poor girl, she's a COVID warrior right now. People are panicking. Flight of the people in the airport. You write that. Your Parul said you're going to write on assurance, right? Explain the situation, talk about the various reasons travelers are taking the flight, of course, and of course their reaction to the delay. So Rajani, so what kind of reactions are they having? Maybe you can explain a little more on that. Worried people forced to get to know each other. It works better than Tinder. Okay, all right. No, yes, John, would you like to explain something more here? The frustration about the situation. Okay. People feeling frustrated, helpless. In Dubai, of course, some will be happy for the shopping part of it. Yes, one of the reasons why I picked up Dubai was also that, Rajani. Okay. Giving the contact or helpline, frustration, helplessness, inform people who are coming to pick them up, borrowing. Okay. There will be panic. I think very beautiful words coming out: anger, sad, frustration, you know, anxiety, mothers having a tough time. Okay, yeah, some people may be Zen, of course, There will be all different kinds. Good. Thank you so much. Thank you so much for all the beautiful responses. So what did you, if you, can you just go back to the chats and see for yourself, how many actually picked up in the scenario, how many of you wrote about the negatives and how many of you wrote about the positives? If you have noticed that most of us have looked and reflected on what is going wrong rather than what is going right. Is it not? Both, but though I did not specify, yes. Yes, ma'am. First, we think about the negatives only. See, if I was just trying to, head count, so out of the all the statements that came, maybe around 4 to 5 of you have written some positive aspects to it, and others have reflected or put in more about the negative. It's not that because your assignment was also stated in that manner that you were supposed to respond in regard to what is happening, what is the thoughts and actions of people because of bad weather. So what happens is that our basic tendency of looking at a particular life or particular situation also is more sometimes more negative than positives. This particular was actually taken up as an activity, and the research that was stated was that the real results behind the real story behind the activity, very interesting, was that it was put in as a very positive newspaper story. And in that story, people were trying to make the best of the difficult situation. Like some of them, some of you have already mentioned that they were, it was better than Tinder. They were meeting people, and then some of them were going for shopping. They were making, taking out chairs. They were sitting down on the chairs. Chairs were made into making chairs out of their luggage, playing video games with each other, playing baseball, because it's definitely you can understand it's a US in the research work, playing cards, sharing food, and just people coped. But a lot of times, even if you're looking at the COVID scenario, what is happening? Always our newspapers, our media houses, they are only reflecting what is going wrong. Yeah, I'm just trying to look at the chat again. Yeah. Any situation, we need to see solutions. Yeah. Right. Yeah, they need to. They definitely they need to. Our media houses, but of course. So and interestingly, what was the reaction of people to that story was that there was an outpour of heartfelt praise and gratitude. This story made them feel better for the rest of the day, even for several days afterwards, and they felt a little more calmer. And the readers said that they wish there was much more news stories which in the paper which was something similar to this. As we have just mentioned, yes, we would like to see more of that. That does not mean that you are not looking at the negatives. It's important to say do that, but why is it, according to you, so important that we also look at the positives? Why is it so important? Okay. I feel that depends on circumstance. Exactly. GFS, except people were such that no one were willing to. But yeah. Yeah. Of course, we have got different situations at hand. Firstly, we will see the negative, then later we adjust and we try to see cope with it. But why do we usually have the tendency to look at the negatives first? Hopefulness will give us good vibes. Yes, that's true, John. Yes, it's true. But I'm just asking, probably evolution. Okay, would you like to explain that a little more? You can come up, you can just raise your hand and speak also, because I like it more interactive. Pallium India, is it possible to do that too?
Yes, yes, ma'am.
Okay, all right. Because Rajini, you have a point there, probably. Yeah, evolution. So, in what way would you like to put in there? What is it that you would like to say?
Dr. Rajni, can you unmute from your end and speak?
Yeah, hi.
Hi. Yeah.
Yeah, hi there. What I said by evolution means like it has been a survival of the fittest right from
Mm-hmm.
the beginning, right? Size from when the
Mm-hmm.
world started. So I
Yeah.
guess that is what comes up.
Yeah.
So
Yeah. Yes, yes, Dr. Rajini, I think it is so true because if we try to see what is the best that we can do in regard to for
yeah,
ourselves, and thank you. And if you also look at it, again, one of my observation from my work as a counseling psychologist for so many years now is that we are also not taught from a younger age to appreciate others and to ourselves, is it not? And even if starting from how many marks have you
that's
got in school,
100% true.
and so every time you bring in some good marks also, it is not never ever enough for parents, or to also just to say, all right, you did not do so well today, that's all right, but we can carry on, we can do something better. And so that basic tendency of having a kind of a unfocused competition with everybody and anybody, and trying to see what can be the best for myself, has become a basic human tendency too. So it is also, I would rather put it as nature and nurture both playing a game out here, right? Yeah.
Yeah, you're right.
Thank you. So, of course, so now we have understood that every day we go through a myriad of emotions, from feeling happy to sad, irritated, angry. Any kind of stress has an impact on our overall health, especially our mental health, and more so in young people, as at times they're not able to rationalize or understand what they're going through. And this has been actually very apparent during these COVID times, when a lot we have been getting a lot of online calls from young people reaching out to us because they have not been able to really understand what is happening in this scenario. But when these emotions disturb our everyday life to that extent that we are not able to function effectively, I think it's time to take charge and do something about it. Right? And especially what has happened, why am I putting in COVID? Because it's a very something of the recent phenomena that is happening with us, and positive psychology and the perception of it will definitely help us to overcome a little bit of anxiety that is related to COVID pandemic. The impact on the person's well-being has been very, very strong out here. The triggers have been very strong. I think because of three main reasons. One is that it is very ambiguous. As soon as COVID hit us, also we were not very sure about what has been happening. Who, so many other informations and interpretations of what it is about. And now that it has said that a different strain has come in, so we do not know what it is. It is ambiguous, it is novel and new. We do not have any experience to fall back on. So suppose, we would have said, okay, polio has come back again, but we would have known what to do because we have the experience of handling it earlier. And then, of course, it is unpredictable. We don't know. There's no clear-cut timeline to say, all right, 2020 is gone, 2021 will be all right. Oh, no, we cannot say that too. So it is so unclear about how things will turn out to be. I'm going to have a look at the chat again. Yep. Yeah, absolutely. Thank you. Thank you for the feedback. So, so this is what I'm just still trying to picture a scenario to you as to what are the different kind of stresses that we will go through and how well-being can be brought about a little bit later. We'll talk about it a little more. So right now I have a 10-point checklist with me on positive mental well-being. Would you like to go through it on your own? Yeah. Would you like to know where you stand as of today? Yes.
Yes, please.
Okay.
Very much, yes.
Good, good, good. So again, to understand, if you take this checklist, maybe 6 months down the line, things will also change. So what you have to do is that if I'm sure you have a pen and paper in front of you. So you just write down, serially 1 to 10. All right. Now, as I keep on putting the statement in front of you, you will be able to just write down either yes or no. So think about it in the last 1 month. All right. So do not bring in everything. So as of last 1 month, how you have been, that is what I'm going to ask you. So question number one will be, am I happy? Just put in yes or no. You don't have to state it to me. Number two, am I enthusiastic about life? You don't have to put it out here, okay? Don't put it in the chat because that's your own self-evaluation. Number three, am I a friendly person? Number four, do I have a consistent behavior? Now, what do I mean by consistent behavior? For example, today you meet me in the corridor and you say, oh, hi, Sangeeta, how are you? And I say, oh, I'm good. How are you? Tomorrow you will meet me and say, oh, hi, Sangeeta, how are you? And say, I just look at you and I just go off. So you may be concerned as to what is happening here because I do not have a consistent behavior to express to you. So for yourself, can you check, do you have a consistent behavior? Now, this particular checklist, the honester you are, the better you are. Okay. Number five, can I live with each problem in my life as it arises? Can I live with each problem in my life as it arises? Number six, do I have an insight to my own behavior? So do I have an understanding of my own behavior? That means. Number seven, do I have a good friend? Number eight, do I have a sense of humor? Number nine, am I happy with my job? And the last one, do I know how to worry one thing at a time? This is where I struggle for myself. Do I know how to worry one thing at a time?
Ma'am, could you please repeat the eighth one, ma'am? What was the eighth
Eighth one,
question?
yes. The eighth one is that, do I have a sense of humor?
Okay.
Ma'am, 10th one.
10th one is, do I know how to worry one thing at a time? All right. So what you need to do right now is that you just need to count how many yes you have for yourself. So the more yes you have, the better you are. Okay. So the more, can you repeat the seventh one? The seventh one is that, do I have a good friend? Ahimsa, do I have a good friend?
The good
And
friend has to, the good
eight-
friend has to be a third person, is it?
No. What do you mean by third person? Somebody outside your family, something like
No,
that?
no, no. I am my good friend. That's it.
Okay. Yes, preferably to be somebody else who is a person apart from
Okay.
you.
Okay.
Yeah.
If I have a self for it and not a yes or a no, where do I come? So I have a column yes and no. Sometimes you have no 50-50. I do have one or two like that, yes and no. Otherwise, it's
I'm
prominently.
just asking, do you have at least one good friend? A good friend. That's all.
Oh,
So
most first question.
yeah, none of them are easy, though it looks very easy, is it not? Yeah?
Yeah.
The thing is that, friends, if you're looking at it, this has been done by Dr. Murray Banks, and he has said that your well-being is basically, this is kind of a checklist to put it for yourself. Which are the areas for improvement? Now, suppose Moshami has said that there is 7 yes and 3 no. So then I will ask you to look at the no's and try to find out how you can make it into a yes. Like, for example, for myself, I still struggle with number 10, where do I know how to worry about one thing at a time? So uh, for me, I have taken certain strategies to help myself to do so. So similarly, now if you want me to, repeat one or two questions for yourself where you have found no, I can do so for you so that you can reflect upon it later on.
Yeah, ninth one, ma'am. The ninth question.
Ninth
I have
is, you have said no, so that means, am I happy with my job?
no. The answer is I have yes and no for it. Meaning, when you say my job, is it a career job or the job that I have taken up? Meaning a family job or what I do as a daily chore? I mean, many things come into the.
Your job is a professional job that I'm saying, talking about right now,
Okay.
when you're
Okay.
saying your
Okay.
job. Yes,
Okay.
and
Okay.
everything try to put it in a month's time. Where do you stand? No? Of course, it may not be the perfect one. It doesn't matter. It doesn't need to be the perfect one. But if you're saying that it is more than 50%, that means you may be happy, right? And if
Exactly. Yeah.
it's less, then it
Yeah.
is not. So try to place it in that way. Okay. So anyone else have any other queries here?
Yeah, Sangeeta ma'am, it's Mosmi here.
Yeah.
Yeah, ma'am, mine is 5, 7, and 8 is no. So, regarding the question, do you have good friends? So, I don't think I have any such friends whom I can share everything. So that's why I have put it as a no. So, ma'am, what how to make it a balance or how to look into?
So, Moshami, can I, so for example, you have said no to 5. That means, can I live with each problem in my life as it arises? Okay.
Yeah.
So uh, write it down and reflect upon it later on, and try to see what are the kind of things that you can do. For example, Can I segregate my timing to think about this particular issue? Do I sit down and do a little bit of deep breathing before I actually handle the problem? So there are a lot of strategies that you can think about. I think that will be like a personal session that comes in here. But this also will help you to reflect upon yourself as to which are the area in your life that you need to work on. Okay.
Okay, okay, okay.
Even if you're
Thank
homemaker, Sunita, that is also your job. I don't think that, when we are saying that, and even if you say that you don't want to put it as a job right now, just ignore that question. It doesn't matter. No? So out of 9 questions, how many you have got for as a yes, Sunita? That will be what you
Thank you,
will
ma'am.
be reflecting on. All right.
Thank you, ma'am.
Because
Thank you.
and a homemaker is equally important. All right, so it is all about our self-esteem, and a homemaker can be a male and a female too, and I respect that.
I
No?
understand. Thank
Yeah,
you, ma'am.
yeah.
Yeah.
So friends are really hard to find. Okay, Rajini. For some people it is so, for some people it is not. And but definitely I think even if you have one good friend, you are a lucky person. And even somebody also said that, I myself is a good friend to me. And I think that can be the luckiest person then. I don't know who said it, but one of you told me that.
Thank you, ma'am. So Prasanna here. Yeah. Thank
Yes,
you.
I agree to that, because if you're not your own friend, you will always be in conflict with yourself.
Yeah, I'm able to bounce back better than get their opinion and not follow it and then feel miserable about it.
Thank you, Parul. Thank you. It's a good test. Somebody, Parul said yes, and So let's go a little further on this now.
Excuse me,
Okay.
ma'am. Excuse me,
Yes.
ma'am. Yeah,
Yes.
will you be sharing the questions with us later?
I have not, because, but if you want, because what has happened, because it's a standardized test, usually we do not share.
Okay, okay.
But if you want, if you can just put it, I can put it in the chat later on for the questions that you want the queries for. Okay.
Okay, okay. Thank you,
Okay.
ma'am. Thank
Yeah.
you.
Welcome. All right. So let us get to the next one. Now, so when I say that positive well-being, who is a person who has got positive well-being? A person where you have a feeling in control of situations around you. Yes, somebody in the chat also said when we feel that the situations are in control, being able to make rational decisions, being in touch with our feelings. A lot of times, like for example, we are angry or we are sad and we don't say anything to anybody, and suddenly we burst out on at the wrong person for the wrong reasons at all. So being able to form positive relationships, again, this is a huge issue among young people also. And I also do a lot of marriage counseling, and I have found that one of the biggest issues is trust building and positive communication. Then feeling good about my own self, the accepting myself as I am with my strengths and weaknesses is something that positive psychology again talks about. And knowing how to look after my own self, we will talk a little more on that too. Okay. So now coming more towards the positive psychology part of it, this is a very beautiful statement where I found about well-being, so I thought of sharing it with all of you. The mere relief of suffering does not lead to well-being. It only removes one of the barriers to well-being. Well-being is a process over and above the absence of depression, anxiety, and anger. So just because if you have an issue or merely having a problem does not mean that, and you overcoming it does not mean that you have got well-being. Well-being is that means it is all encompassing, and it also touches upon all the aspects of your life. Mhm. So coming to a little bit of the definition of well-being and what well-being about positive psychology and well-being. So Martin Seligman, we all have heard about him, and Mihaly, don't ask me to take the surname of him. I haven't been. I tried to Google voice it and also hear, but I couldn't attempt it. So I'll just put him as Mihaly. Describe positive psychology in the following way: We believe that a psychology of positive human functioning will arise that achieves a scientific understanding and effective interventions to build thriving in individuals, families, and communities. So, what is your observation on this? What is your take from here, from this statement? What does it tell you? Can you pick up the points from here? All right. So, John, I was just saying that, from this particular statement, which has been given by Martin Seligman and Mihaly, what are the points of elements that you would like to reflect on, to understand positive psychology? See, for example, here it is saying that we are looking and focusing on positive human functioning, yes, as number one, right? Unless I am well, will I be able to look at a society right? Yes, absolutely. Unless you are, if you are not okay, you cannot help somebody else. You have to empower yourself first. Positive human functioning, right? Then again, other thing, if I'm pointing out here is that, you know the scientific understanding of it. So they are trying to make it more evidence based, but unfortunately, positive psychology, it cannot be very kind of evidence based. 100% effective communication, yes. Okay, I feel it's all can be utopian society requirement. It is very utopic in a lot of ways, positive psychology. And that is why I was saying that scientific understanding is very difficult also at times, because there's no clear cut, stimulus and response to this, or the before after picture can be not very clear as a behavior therapist will be able to take it out. So, and then, but what is one word which is very important here is thrive, is to thrive. So I'll admit somebody who is coming into this, Dr. Vasundhara, I think, okay. So thriving means you are going beyond just living, but you are also excelling. You are looking at your strengths and you are able to recover and uncover them, and also recover and discover yourself more and carry on with that. All right. And it is not only on individuals that the person is, fixed on. Martin Seligman also said that um, you need the family and the community also as a whole to be positive. So creating the positive environment around you also becomes equally important if you are able want to enhance yourself positively. If there's a very beautiful saying that it takes a village to raise a child, and I definitely agree to that, because you cannot bring up a child alone. You need everybody's support to bring up the child. So, if you're looking at the definition of positive psychology, what has happened is that even before World War II also, mental health professionals have always looked at it from the purpose and from the perspective of disease model. That means we are looking at mental illness, we are looking at maladaptive behavior, we are looking at negative thinking. And so the manual that we follow is called the DSM, and if you are not labeling the person, you are not able to move on with that person. So before World War II also, psychology had three main missions: to understand and cure mental health, to improve the lives and productivity of individuals, especially who were in the army and the navy and the air force, and to identify and nurture higher talents. So again, survival of the fittest was something that was talked about. So definitely, if we can reflect on what we had discussed earlier. Positive psychology came into field as a result of the overuse of abnormal psychology. Well, it's a statement which you can use, but I will now, it is a different way of looking at it. That's all, John. I don't think everything has its own place to go for. Today, if a schizophrenic person comes to me, I will not be able to only use positive psychology with him. I will have to go beyond that. A person who has got a personality disorder, I may not be able to go only from the perspective of positive psychology. So we can put it from that you are coming from the different streams or the different ways to look at life, and but the goal is the same: is to get relief. So Swami Vivekananda also stressed about the power within us and to take charge. Absolutely, very true. I do agree to that. Yeah, and happy self follows happy family, 100%. So, I'm really enjoying this interaction. So please keep on continuing. Thank you so much. Yeah. And so what has happened is that gradually people found that it was not helping as much as it should be. So they were trying to find out that we were ignoring the positives in people. We were only looking at what is going wrong and never as what is going right. But in counseling psychology, as a counseling psychologist also, I always look at it as what is going right for that person and how the person can help himself or herself based on the strengths the person has to overcome those weaknesses. So that comes from the humanistic perspective more, and so the approach is more from the humanistic perspective. For people working in the human potential and well-being area, so there was no common language or identity. So that is what Martin Seligman tried to do for us, is to bring in a science of happiness and saying that life is worth living. And so the focus became more related to eudaimonia. Eudaimonia is more of happiness and fulfillment and life satisfaction altogether. So optimistic thinking, motivation, and the most important thing is resilience. And I think what we have to now struggle with is resilience during these COVID times too. Yeah, counting our blessings also helps a lot, Paul. Absolutely. So the scientific study was more on the strengths and virtues that you have, which enable the person or the individual and the community to strive and to excel. So what we are talking about is more of positive subjective experience. So what is your experience of life or something that has come in? And that is the fallout of people going into mindfulness practices, people going in for so many other, esoteric and aesthetic and the spiritual journey of people. And nothing needs to be negated, because a lot of times my clients come and tell me that you may not believe in it, but I'm going for such and such kind of sessions which are more spiritual in nature. I said, do whatever is good for you, what you feel good for yourself. We need that feel good factor for ourselves, but do not also ignore the scientific approaches that we have got. So it can always go hand in hand. Okay. Yeah, social support and personal resilience, very, very good. Yeah, yeah, right, John. So it builds further on the humanistic movement, as I said, of Maslow, Rollo May, James Gettle, and Carl Rogers. So they all said that, they have a similar thing to say, that given a positive environment, people will thrive. And so, and also unconditional acceptance of a person. So these are the two elements that they play with, and that was have been the foundation of positive psychology. Positive psychology, the word eudaimonia, as you said, is about good life, and it also does not mean so. Good life, it can also be interpreted as hedonism. Just going on doing whatever is the pleasure based on that, means the pleasure principle. But here, good life does not mean that. It is meaning that well lived, and it is a fulfilling life, and there is a meaning attached to your life. Okay. So positive psychology is more descriptive than prescriptive. So you just cannot write it down. Okay, you are going to do this kind of things, and you will be okay. No, it is more about internalizing yourself. You're trying to look at yourself, having your insights to your life, and acknowledging who you are as you are. In other words, it does not tell you what to do, but states the factors that enable people to make informed choices. Again, here the core point is informed choices, so that it helps you to have a fulfilling life based on your values and interests. So it is very individualistic in that way. So the basic premises that has been laid on is human goodness and excellence is as authentic as disease, disorder, and distress. So that means if you have bad people in the society, you also have good people in the society. Positive subjective experiences is what is more based on. It is based on the individual positive traits, and it's also based on positive institutions. And I think Mind India has put its own premises on, positive mental health and well-being, because this is our premises on positive psychology too. Because our mission also says enable people to choose change. You can only create that environment where people will feel that that change is important for them. All right. So one of the basic elements, I'll just look at the chat again. Yeah, of course, diet and exercises. Yeah. You open your TV, you will have everything there. Everybody now WhatsApp, I think half of it is all about those slogans too. Okay. Now, Martin Seligman, he based positive psychology in 5 core elements of psychological well-being and happiness, which he calls it as PERMA. So it's a very easy way to remember. PERMA is positive emotion, engagement, relationships, meaning, and accomplishment. So let us look at it one by one, what it is. You can just jump in and talk to me anytime you want, all right? Okay. See, the basic emotions that Seligman talked about, PERMA P is positive emotion. It says that how you can increase positive emotion of the past is by cultivating gratitude and forgiveness. A lot of us, keep a lot of grudges with us, and that again creates a negative environment around us, creates negative self for us, but our perceptions on all negative. So gratitude and forgiveness are the 4 points that he points out here. To increase positive emotion of the present is by savoring the physical pleasures, savoring what is around you, and to be mindful of the present. To work as for me also, I struggle a lot with mindfulness myself. Because I'm more of a future oriented person. So for me, I have to bring myself back to the present to say, all right, let me enjoy this moment and let me be focused here. And to have increased positive emotions about the future is by building hope and optimism. And I think we all live on hope and optimism, right? We are hoping that things will become better. We are always looking for the day forward and to see whether we will get something more positive out of it. Now, interestingly, Mihaly, he talked more about the engagement part of it. And Seligman also said that engagement is an experience in which someone fully deploys their skills, strength, and attention for a challenging task. According to Mihaly, this produces an experience which is called as flow. I'll come to that a little later. Flow is that it is so gratifying that people are willing to do it for their own sake rather than because they have to do it. For example, sometimes it may so happen that you're having such a good conversation with people around that you do not you forget about time. You think, oh, it has just flown. I don't know what has happened, or you've been so busy with maybe your embroidery, maybe your work, your some creative stuff that you have been doing, or reading a good book, or building something, gardening, sports, anything like that. So you're so involved in that that you do not remember what is beyond that or before that. So this is what is flow about. Then again, because relationship we keep on talking about it is very important because we are social people. Not everybody needs relationship in the same way. I will come to the chats after I finish with accomplishment. Okay. So relationships are always there, but then relationships are something that I don't know. I'm just admitting people who are just waiting in the waiting room. The experience that contributes to well-being are often amplified through our relationships, which are great joy, meaning, laughter, sense of belongingness, and pride. Because we always have that feeling that we need to belong to something, even if it's belonging to the family. No, when only yesterday when a young girl, not, I mean, she's not very young, she's around 35 right now. She has not married, she's with her family, and she's a working girl, a very accomplished director and a short film writer, things like that. And she said that, ma'am, you know what? Um, I still hesitate to hug my mother. My mother has never hugged me on her own, and I crave for that. I didn't have anything much to tell her when she said that. You know? So expressing kindness to people also increases our well-being. You know, the relationship matter is from that perspective too. That's not mine. Somebody's mobile is on. So that comes to the next one from Parma. M has come now. A sense of meaning and purpose can be derived from belonging to and serving something bigger than the self. So, and that is why a lot of us also have something within us to say that let us give it to the society a little more. Let us do something more. The community feeling that we have got in regard to anything. And well, people say that politics also helps. Well, that is a different chapter altogether, I believe. Then accomplishment is where people pursue accomplishment, competence, success, and mastery of for their own sake in a variety of domains, including workplace, sports, games, hobbies. People pursue accomplishment even when it does not necessarily lead to positive emotions, meaning, or relationships. So all these are, you know, it's an amalgamation of everything together. You cannot just leave one aspect of karma and say, oh, I'm doing those. It has to go hand in hand. So yeah, I will now look at the chats now. Okay, so uh, John said, do you know, do not you see genuine happy people from poor economic areas? I don't know from where that flow had come, but then I think happiness is a state of mind. So it cuts across all economics and all the age groups and all kind of communities. Forgiveness is most important, else it makes us a villain doing what we like. Yes, hugs can be a bliss, of course, it can be. And just yes, charity does come under that about meaning in life. If that is what you're saying, Rajini, yet it is so. Mm. All right. So we are clear till here, I believe. So I'll go a little further now. Okay. Now coming to what flow is. Um, Mihali, he states that an activity initially undertaken for other reasons maybe, the activity then starts consuming in such a manner that mm, consumes us in such a manner that it becomes very intrinsic and becomes rewarding for us. So here, one particular word which has been stated by.
ये मेरिट पेशेंट आता है अब तो आप सोमवार आना.
Okay. All right. Somebody can put it on mute somewhere. Yeah. So the term which has been very attached to flow and to positive psychology is called autotelic. What is autotelic? That means auto is self and telos means goal. So it refers to a self-contained activity, one that is done not with the expectation of any future benefit, but simply because the act of doing itself is so rewarding. And that is what flow is about. So if you look at this, you will find that your skills are on this end and the challenges are on the other end. And the flow state which is here is where you are moving towards actually self actualization. If I'm putting in Maslow a little bit out here, so where you are enjoying that moment so much that you are on your own zone. So some people, when you say that, oh, I'm in the zone, or so things like that also comes in here. So on one hand, you may not be doing very well because there can be panic and stress. On the other one, you may not be working at all because of comfort and complacency, but the flow is opposite to is inai. Inai is where you are not doing anything at all. There is stagnation there. And flow is when you are moving towards that self-actualization, where you're moving towards that state where you are there and the work itself can be so rewarding that you do not need anything else there. So that is the state that a lot of people look forward to in positive psychology. Now let me come to a little bit about a communication pattern that we can look at in psychology. One of the three areas that we will be looking at is what you will be looking at is you need to check on the development of pathology. You're changing negative thinking pattern and change maladaptive belief system. But what we are going to do is that we are not going to look at what is going wrong, but what is going right. But to do so also, we need to find out what are the areas or the issues of a particular person. Now, I'm going to read out something and maybe you will be able to point out. So I'm banking more on your listening skills now, because as counselors, also as people working in different fields with human, with relationships, it is important to enhance our listening skills. All right. So here is the statement. This particular person is 35 years old and he has given this statement. I am the only earning member, and due to COVID-19, I have not been able to make any marketing calls physically. Most days, I am sitting idle as there are no calls. This is making me very nervous these days. I was traveling all the time, and now just sitting at home without much work is not making me feel good. At times, it is very frustrating as my family thinks I'm going to lose my job soon. They also have started to worry a lot these days because we do not have backup plans. So, what are the issues that you find with this particular boy? Job uncertainty, self-belief, either less or low. Okay. Low self-confidence right now. That's what you mean. Yeah. Yeah. Job insecurity. Unable to handle himself. In what way? In what way? Panicking about the future, fear, anxiety. Yes. The predicaments of the unknown, worried about the family. Very true. Yeah. Feeling of helplessness. Absolutely. Good. Boredom also, yes, because true, the traveling has gone down. Mm, yeah. The beauty of life is the uncertainty. Yes, that's a positive way to look at it. But for this particular boy, he must have not looked at it in that way. All right. So some of the things that we can look at, and what will be important for us to also understand his maladaptive, not maybe may not be to that extent. I'm not very sure as what you mean by maladaptive adapted here. But we are just looking at the present scenario and situation for him, where we do find that he's anxious, there's anxiety there, he's not been able, there's a loss of hope, hopelessness, helplessness, all that feeling is also coming in for him, right? No, not sure how to improve the career prospects. Okay, thank you very much. So I'll move a little forward from here now. So what has happened here is that there are now I'm going to talk about a little more about the communication patterns that we can check out here and what we need to do as a person who is addressing or who is helping him out here. So as a counselor, maybe, there are certain things, strategies that I will take. Number one win is that let's listen and not hear. So listening physically and psychologically is something that it's very important for that. One of the ways also, even if you are doing telecounseling or even if you are sitting in front of that person, how you're going to sit down with that person becomes very important. For that, suppose, if you when if you're looking at me right now, uh, my shoulders will be straight. If I'm looking at the other person, there will be eye contact. I will lean a little forward. There'll be a smile on my face, and I will be putting my palms up. In the palms will not be down. So what happens is that I have this open posture for myself where I'm saying that I am ready to listen to you. And when your spine is straight and your shoulders are straight, your attention automatically increases and you are mindful and you are in the present. So, and as you keep on talking, you also check for understanding. You keep on trying to find out with the person, uh, am I being able to understand you, or are you able to tell me, or am I being able to understand what you are telling me? So, checking for understanding both ways becomes very important. The next one is that for this particular boy who said that I have not been able to do what I have been doing, I am so nervous these days. No, why you are nervous? No, instead of saying and why, rather said, how I can help. How is it possible that, is it possible to do something on your own? How have you helped yourself first? And also remember that, in positive psychology and in counseling, we always try to find out what the person has done for himself or herself. Nobody just comes to or seeks help without trying something on their own first. So always try to find out what the other person has done before trying to find out the ways and strategies or the intervention for the person. Then, of course, comes the body language and the communication part. Look for a lot of non-verbal cues of what is happening here. And when you are talking, when you're using your palms and your palms are up there, instead of saying, why don't you do this? These are even for official and corporates also. We always say that putting or pointing it out rather than pointing out your finger, can we use the palms, because that is very non-threatening. And that communication becomes more positive in nature then. Then, of course, our tone and the tonality of it, of how we say it, it's the content may be the same. Like if I just have to say that, oh, you're looking very nice today. Suppose I say that, and then it may come up as, is it a compliment or not a compliment? Because somewhere from, I think, Manisha, you just put your mask down, yeah, and that's why yeah, or your friend put your mask down. I saw a lovely smile there, yeah, so it was a good one. So if I say that, oh, you looking good today, so the way I said it, and the other one, the first one where I said, oh, you're looking good today. Then I may say, all right, she's got a new dress. She must have got her salary. I did not get mine yet. So there can be a lot of misinterpretation from my tone. So how I say it becomes very, very important here. Okay. Then always try to see what is the kind of language that they are using. There are a lot of times people use the language which is very alien to the client that comes in. So try to merge, try to get into the scenario of the person. There may be somebody who is coming from a remote place and they may not be understanding the urban languages that we have got. And towards the northeast and in Assam, I am in Assam, and we have got so many dialects and ethnic people. So uh, there are, we have got Upper Assam, we have got Lower Assam, we have got Middle Assam, and all the different dialects are there. So sometimes we can connect to the other person immediately when we are speaking their language, and the way, and some of the language, you may not know the full language, but pick up on some of the words that the person is using. Then immediately you can get a connection done with that person, and they will be able to listen to you well. Yeah. And then again, even for young people, it is very important to visualize, to empower yourself. To do so, you have to visualize the best in you. What is the best that I think about myself? I look at myself. And those are exercises that we will talk about a little more after some time. You know, some of the exercises on positive psychology that we can take up. Okay. So a chat is there. So yes, hi, Parul. It's so nice. You're from Dipshika. Yes, my students go there. Absolutely. That's nice. So, okay. So a lot of times we have misinterpretations because we do not know how to give feedback. So to give feedback to any conversation, it's very important that number one, focus on specific behavior. If you say you do it all the time, well, the person will always tell you, I don't do it all the time. But if you say that, you just did it and this is what I was talking about, then they will be able to change that. Keep feedback impersonal rather than saying that, bringing in a lot of emotions out there. Keep feedback goal oriented because I want it to be changed, and that is why that feedback is important. Then it has to be well timed. That means it has to be given immediately. If you're giving it after 10 days, this person will going to forget what was that particular incident that must have happened. And ensure for understanding that if I have given you the feedback, have you understood what it is? And direct feedback towards the behavior that can be controlled or by the recipient. Now, if you see people from behavior therapy will also say that, oh, these are the things that we also do in behavior therapy. But what we are doing out here is that we are adding the kind of positive areas and creating that environment also when we are talking about it. So it is a mix of positive psychology and behavior into that. Then, okay. So now coming towards another two slides more for me to complete this, and then after that we can have a little more interaction. All right. So what are the benefits of well-being? What's the benefit of positive psychology? Compared to people with low well-being, individuals with higher levels of well-being will perform better at work, have more satisfying relationship, more cooperation, stronger immune system. Now you ask me how stronger immune systems. I think because you are going to look after your health, you're looking after your well-being, you're looking after your emotions, you're managing them. So definitely your immune system will also increase, have lower levels of burnout, self-regulation and coping abilities. See, emotional intelligence and all that also are the fallout of positive psychology. So if you see, there's a lot of amalgamations of all these different approaches which are coming here. People tend to be less depressed and anxious and better performance at work. And very interestingly, there's also faster recovery from surgery too. Because of the kind of mindset that you have, this well-being, overall well-being comes into play here. Okay. So again, I end with some things which you can reflect on for yourself. Now, I started with self and I'm ending with self because I think this is what we can manage, right? And as all of you have said, that if I'm able to manage myself, I can manage anybody else. And it is not about controlling, it is about how comfortable you are in that particular environment or scenario. So using signature strength in a lot of ways, there has been 24 signature strengths which has been given by Martin Seligman. You can have a look at that. Now, I'll just read it and then I'll come to this of what is the activity that I want you to do. So one is using signature strength in a new way. The second one is three good things of life. Next is three things that went well in each day along with their cause. Gratitude visit, write a letter of gratitude and then deliver you at your best, write about a time at your best, review once a day for the week. Now, what I want you to do is that sit back, look at this, and select for yourself two things that you are going to do for yourself. Okay. So did somebody say? So count my blessings. Yes, Parul, you would like to do that. Yeah, count my blessings. Okay, very good. Yeah, and bring a smile to others too. You know, because when you smile, you cannot frown. That's what I say. So what I would like you to do is to speak up rather than putting it in the chat, because I think that will be more interesting for us also to talk about it, and because it will go into our conversation also. Sometimes it is also very interesting that as a family, what you can do is that you can have a small whiteboard on the wall, and all of you can write one thing that we're gratitude about for the day. Like we do the thought for the day, it can be a gratitude board for you. So that is also something that you can do. So this was more of a reflection about something that we are doing for ourselves. Like sometimes we do not focus on our strengths. So using our strengths, focusing on it will help us to look at ourselves. Three good things in life, the gratitude that we have got for that, help others and feel good will make a difference. Yes, of course. So uh, I have come to the end of my in the conversation right now. Gratitude visit. Where would you like to visit, Alpha? Listen to someone in distress. Absolutely. Now the world has come to such a time where we are only doing saying bhashans, where nobody has a time to listen. So of course it will be nice to have people who will listen to us. That's okay. That's okay. Yeah. Okay. So I end with the last statement, which is written there. Only when you operate from strengths can you achieve excellence. And the excellence is where you are accepting yourself as you are with your strengths and weaknesses, and you are discovering yourself and exploring yourself all the time. And understanding self is a never ending business. So please carry on doing that. So with that note, I thank all of you. These are the reference, and this is my address here. Yeah. Okay. So thank you very much.
Thank you, Dr. Sangeeta, for that wonderful section. So I think we have got another 15 minutes. If anyone wanted to ask anything or comment about this, you can do it.
Yes, please.
You can unmute from your end and speak if you want.
Yes, please. Rather than putting it in the chat.
Ma'am, this is Shriya Prasanna here.
Yes.
I'm not a psychologist. I'm a dentist. My interest in 2017 changed to neuroscience, and I then went to clinical neuroscience.
Mm-hmm.
And it was during that time, or a little prior to that, I came across what you spoke about, emotional intelligence,
Mm-hmm.
because I was working with children with learning disability at that point. And I'm not sure whether many would have heard Kazimir Dabrowski's positive disintegration.
Mm-hmm.
And it actually kindled my curiosity.
Yeah.
He's basically a Polish, and he worked with children mental health illness.
Okay.
And what it says is sometimes the name itself is very different. It's disintegration. Disintegration is, when you look at it, it's negative. But when you say positive disintegration is whatever you're suffering with the ailment, and it's purely got to do with mental health.
Yes.
All of us are not normal. We all have some amount of mental health illness. And if we are able to overcome them, then we are positively disintegrating and we evolve into something new.
Right.
And then when we want to revisit our old, we can't, because we've already evolved. It's like a little hen or little chick coming out of the egg. It can't go back into the egg. It has come out. So it's formed one stage of it. It has to go to the other.
Yes.
And I was able to appreciate this when I read Elizabeth Ross' Grief and Grieving.
Yeah.
As I lost my father due to,
Yes.
not because of cancer, but because of, he felt that he was abandoned by his family. Because my mom was in Kodaikanal, my brother was in the US, and I was the only one taking care of him. And at a point, I couldn't take care, and I kept him in a palliative care, and I used to visit him alternate days. But at that point, I realized how much of this positive disintegration actually is applicable. And Dr. Ross's book of Grief and Grieving.
Yeah, absolutely. As Elizabeth Kubler-Ross, yes.
And I'm not the same Prasanna Shriya who was before 24th July 2020. I'm totally a different person, and I'm not even able to revisit her anymore. So some amount of pain is required in life for us to evolve to the next level in the ladder. Just like how we say, I'm getting a hike in my salary. It's because I've done something new, or I've studied something new, or I'm more qualified for the job. So some amount of pain is required to improve ourselves, to integrate better, as in with ourselves and with the society.
Prasanna, Shreya, thank you so much for this beautiful information. And I hope all of you, it's a new learning for me, this particular word I know, but then what you have been saying about this person, gentleman, I have not read much on him. But we talk about, see, even if when you are looking at from the psychology viewpoint, you cannot learn something unless you unlearn so that you can relearn, is it not? So even when we are evolving, and what you have talked about is that we need a little bit of pain. For some people, they may not be happy taking that pain, but you have taken that pain positively and you have gone beyond. So that is what is all about thriving in positive psychology. Also, this is also, there's a beautiful word which is called anti-fragility. Anti-fragile. So anti-fragility there's a book on that also, which has been by Dr. Tallinn, and he says that when it is not only going, you are not only being resilient, but you're going beyond resilience, so that you are excelling beyond resilience. So your pain is there, but you have overcome that and you have gone beyond that to excel and thrive, and that is called anti-fragility. So that pain has helped you to evolve more. And this is exactly what you had done for yourself in regard to your dad. So thank you so much for sharing it. Thank you.
Thank you, ma'am. And with this, I'm able to appreciate Dr. Rajni. When she and I, we feel it's because of our stretchability. We are able to stretch ourselves beyond our own limit. Every time we don't set a limit, we try to push that limit little further, more and more and more. So we don't have a friend who could give us a listening ear. Because a friend would first say, why did you do beyond what you could do? Whereas our nature is to do beyond what we can do.
It is true. It is true. Thank you so much. Yes.
Thank you.
Dr. Sangeeta, you have talked about positive techniques. So Dr. Rajni was asking about what have you mentioned in signature? Signature strength. What do you mean by signature strength?
All right. See, in signature strength, what I have meant is that means, see, there are certain strengths which we feel that it is core to you, right? Like for example, if you are a very patient person, and that is a strength for you, that's a positive point for you, and you may be born with that. So there are certain strengths which are a gift to you, and there are certain strengths which are effort to you. For example, as I said, patience is something that comes very naturally to you, but maybe communicating with others is an effort for you. All right. So your gift and effort is, that means something that you're born with, and the other one is where you are actually cultivating and developing it. So you're using your signature strength, is that means that these are my core elements. So if I ask you, Rajini, what are you good at, what are your positive points, then the ones that you will say that are your signature strengths.
Thank you, Dr. Sangeeta. Any comments or any other pressing questions?
Yeah. It does become hard when some people do not see what you see. Yeah. And so accepting that is actually positive psychology, that I am different from you, but I accept as you are, and I'm accepting myself also as I am. So it's okay. No, we agree to disagree. That means. Maybe she has reached the flow state. Yes, for Sunita, you're right when she said that maybe she has reached the flow state, and that flow state, it can be a very awesome feeling. Absolutely. I have experienced it, a few times myself, and I'm hope to experience more actually the flow state.
Seriously, even I've experienced it now.
Yes. Right. I think so. I hand it over to you, Manisha.
Thank you, ma'am. Thank you so much for that wonderful session, and especially the activity which you have made us do. It really worked a lot. I thank all of the participants for today's session. We will see you next Friday with another topic. Till then, bye and take care.
Thank you, all of you, and have a wonderful year ahead. Bye bye.
Thank you, ma'am. You too.
I'll stop sharing.